So, hi everyone. Thank you all so much for joining me today for Lifestyle Medicine Week, where we are raising awareness regarding the impact our choices can have on chronic diseases. Today, I have the pleasure to be joined with an extremely talented panelist of experts, and I'd just like to go around and let each panelist introduce themselves, if that's okay. Adele, I'd like to start with you, if that's okay.
Thanks, Kate. Thanks very much, first of all, for asking me to join today. My name is Adela Doherty. I'm a nutritional therapist. I've been working in this field now for about 8 years. I'm trained in functional medicine and lifestyle medicine, and I use nutrition and lifestyle factors to help people manage chronic disease as best they can.
Thank you. Thanks so much, Adele. And Ola, would you be able to introduce yourself?
Okay, thank you so much, Kate, for inviting me to attend the webinar today. My name is Ola. I am a community pharmacist. I have been practicing in community pharmacy for over 20 years. And I decided a couple of years ago to study nutrition, and I am studying functional medicine as well. So I have a big exam coming up. So yeah,
Yeah.
under pressure with the study, but yeah, I just incorporate now functional medicine and lifestyle medicine in my advice for my patient, which I am so enjoying it.
That's so good. And thank you so much for joining us, Ola. And finally, Padraig, would you like to introduce yourself?
Yeah, thanks, Kate. So my name is Porrick Dunn, and just to say hello to Ola and Adele, nice to meet you for the first time. So I'm a senior lecturer in the Royal College of Surgeons in Ireland, and I'm part of a new centre called the Centre for Positive Psychology and Health. So I'm a research scientist. I worked in immunology for a long time in the UK and Ireland, and then about 10 years ago, I retrained as a psychotherapist because I'm interested in the kind of interface between mental health and physical health, which we tend to walk around as if we're a giant head, but we're actually connected.
Yeah.
So I'm interested in kind of education for, public education, postgraduate education,
Mm-hmm.
and research in that field.
Very good. And thanks so much for joining us. To start off, Ola, I might turn to you first with our first question, if that's okay.
Yes.
I just wanted to ask, would you be able to briefly explain to our viewers what is lifestyle medicine?
Okay, so I will explain it from my own point of
Yeah.
view. Okay,
Yeah.
so as I said, I am a community pharmacist. I am trained to obviously work with conventional medicine all my life, and all my experience is community pharmacy, and I've seen patient over the years coming back, with the same problem, with the same symptoms. I felt I have a gap in my knowledge, and hence I studied nutrition and functional medicine. And to be honest, lifestyle medicine is literally is preventative medicine in my eyes, or in my views. So how can you help people to kind of change or maybe tweak their lifestyle a little bit to enhance their condition, or even to prevent chronic condition if we get them to change and tweak their lifestyle early. So this is the way I explain lifestyle medicine. Is like working with conventional medicine and lifestyle changes, and obviously
Mhm.
diet changes as well. So it will include lifestyle changes and diet changes as well. This is how I
Okay.
explain it to anybody.
Yes.
Yeah.
Yes. I suppose everyone has their own view on it and things. Yeah.
Yes. Yeah.
Yeah.
Exactly. Exactly.
Yeah.
Yeah.
Um, I know there is six pillars within lifestyle medicine. I was wondering, Adele, would you be able to explain the six pillars, please?
Yeah, so I suppose in the UK and Ireland and worldwide, there's a number of different kind of lifestyle medicine groups. Ola and
Mhm.
I think the British Society of Lifestyle Medicine didn't really exist when I started training. And Ola and I both went to the US because, from a lifestyle medicine point of view, they've kind of been leading the way for quite a long time. And that's why we
Mhm.
started our training with the Institute for Functional Medicine. The British Society of Lifestyle Medicine now exists. And to be fair, the pillars overlap and they're exactly the same thing. But, the first one really is healthy eating.
Yeah.
As lifestyle medicine practitioners, what we're trying to do is encourage people to reduce their intake of processed foods
Mhm.
across the board, try to teach people how to eat a healthy, balanced diet, and also provide them the knowledge and skills to be able to do that. Because, really everybody knows what they should be doing. But the
Yeah.
gap is, why are we not doing what we know we should be doing for our health? And what are the barriers and boundaries to that? And there's a whole, wealth of learning and expertise in the area of coaching and helping people through lifestyle change, because everybody really does know, for the most part. I mean, there are gaps in people's knowledge, and it's our role to provide them that information and teach them that knowledge, and then provide them with the skills to be able to do it. The next pillar is mental well-being. Techniques to reduce stress, to manage stress. Stress is ubiquitous. There's, for a lot of the stresses in our lives, there's not a lot we can do about them, but we have to learn the techniques and the skills to manage that stress, to support relaxation, and really importantly, to support resilience. And that's one thing I'm seeing in a lot of the younger people and the teenagers that I'm seeing, that they're losing the ability to be resilient. And I think that's really important, because challenges are always going to be there. We want people to have purpose in life, and also to reconnect to nature, get reconnected with the rhythms of life, because people often think circadian rhythm is only related to sleep, but there's rhythms in life for everything. The third pillar is healthy relationships. And that's another thing. I work a lot with people with cognitive decline, and I've seen a huge increase in the amount of people coming to me, even people that I had been working with before who had cognitive decline, when they lost social connection through the period of time that we're experiencing the pandemic. Social connection is essential to our physical and mental health, absolutely essential. We're social creatures. We need other people. Now, we all need time on our own and silence as well, but we really do need social connection. I mean, there's bucket loads of research out there about how it helps us reduce stress, how it helps us boost our happy hormones and feel generally happier on a day-to-day basis. The fourth pillar is physical activity. Helping people find ways to incorporate movement into their lives on a regular daily basis. And we don't just mean structured exercise, we just mean movement. It's really essential. Like, obviously structured exercise is really important as we age, and we need to maintain our muscle mass and all of that. But movement is really important as we age. There's an awful lot of research now saying sitting is the new smoking. It's as dangerous to us to be sitting all the time as it is to be smoking on a regular basis. And minimizing harmful substances is the next pillar. So reducing smoking, eliminating it if possible, reducing our alcohol consumption. We all know that, particularly in Ireland, we have a really unhealthy relationship with alcohol. Addictive substances, prescribed addictions, non-prescription drugs, obviously. And then the other addictions that we have in our lives, addictive behaviors like gambling. I really want to scream at the TV every time I see an ad for Paddy Power, and some rugby match or football match. Social media, excessive internet use, they're all addictive behaviors and harmful. Even food can be an addiction. So we're trying to minimize the intake of those harmful things. And then the last pillar is sleep. So helping people to get good quality sleep, recognizing the behaviors that are preventing them from getting good quality sleep, bad food choices, alcohol, the phone, social media use, and of course, stress. And finding it difficult to manage stress disrupts our sleep.
Yeah, I think it's funny that you mentioned, being on your phone and social media as an addiction. I think a lot of people, especially maybe my age, may not realize it is addiction. And then they find at the end of the day, you might spend 3-4 hours on your phone after work.
Yeah.
And I think people don't realize how bad it is for your health. But I picked up, you also mentioned physical activity in one of the pillars. And I was wondering, is physical activity and exercise the same thing?
So physical activity and exercise are not the same thing. I had a little look there actually on the Irish Heart Foundation before I came on, because as I said, sitting's been dubbed the new smoking, right? So I said, what are the statistics? Because you can't just throw out statements like that without, having the numbers to back it up. So they're in the research, they've proven that sitting for more than 6 to 8 hours a day, which a lot of us do, right? To be fair, we do it for our jobs, without any movement, increases your risk of diabetes by 112%. It increases your risk of having a cardiovascular event by 147%. it increases the risk of death from a cardiovascular event by 90%. And it increases your risk of death from any cause by 49%. So if you're sitting 6 to 8 hours without moving, bar maybe, for a coffee or lunch, it's really, really detrimental to your health. And it's one simple lifestyle change that we can make without really very much effort, is to reduce the time that we spend sitting. And I don't mean the overall time, but the, consistent time without any movement interspersed there. And there's lots of things you can do, simple things you can do, like setting a timer on your laptop or on your phone to remind you to move once an hour. Get up, move around and stretch. There's so many apps, and, Impeel app would remind you to move, to stretch, and I try to tell people to try and incorporate it with their water intake. So once an hour, get up, go downstairs, fill a small glass of water and drink it. So if you do that once an hour for 6 hours, you're drinking 6 small glasses of water a day. Watch your posture as well while you're sitting. Poor posture results in bad blood circulation, reduces your muscle strength. Keep your chin tucked in and your shoulders back, these sorts of things. Trying to be mindful, keep your stomach switched on to protect your back, because back pain and back injuries are a huge issue from sitting all the time. And getting a standing desk, I have a standing desk, so I try and move between one and the other quite a lot. And then while we said, movement is not exercise, movement is just walking around, setting that timer for once an hour to just move around, stretch a little bit, release some of the tension in your body. If you can go for a walk at lunchtime, particularly now coming into the summer months, that's the most beneficial thing you can do, to get out in the sunshine, get some fresh air, move your body a little bit. And also commit to exercise. We really do need to do the structured stuff as well. Committing to exercise on a daily basis, even if it's just a walk, that is the most beneficial thing we can do. Every single minute of movement counts.
Yeah, I think as well, a lot of people might sit at their desk for, 7, 8 hours, but they would have, a structured time between 6 and 7 to go for a walk. Would you say, like, how important it is to actually move during your working day as well as doing your hour of exercise in the evening?
Absolutely. I couldn't agree more. At least once an hour, you need to be standing up and moving away from your desk. And
so it's
moving
not
those
enough
muscles and stretching.
Yeah, it's not enough just to do the exercise. At the end of the day, it needs to be.
It's absolutely better than nothing, doing the exercise on a daily basis, but movement regularly is what's really, really important as well.
Yes. And Padraig, it's okay. Can I turn to you now? I just want to ask, what part can lifestyle medicine play in managing stress and improving the well-being of a person?
Yeah, thanks, Kate. That's a big question there. So I think first of all, it's important to say that not all stress is bad, right? So there's a type of stress called eustress, and if you didn't have that, you'd never do an exam. You probably wouldn't get up in the morning. You probably wouldn't have a job. You probably wouldn't have friends. You probably wouldn't bring your dog for a walk. So these are the things that give us ambition. And we know that these things are important in terms of meaning and purpose in life. So stress isn't all bad. What's bad is distress. So when the challenge becomes overwhelming, and now we're heading into a different zone. So I think it's important to call that out, because we do need that drive. These hormones are in us for a reason. They do a good job. They actually do help us. But it's when we get overproduction, disbalance in the system. For me, lifestyle medicine is all about balance, just like life is generally, So all of the things in us are there for a reason. Stress hormones like cortisol, there for a reason. Adrenaline, there for a reason. It's when these things get out of control that they cause a problem, right? So for me, lifestyle medicine, all the pillars are intertwined. There's really no difference between any of them, because for me, it's like that analogy of, a rising tide lifts all boats. I mean, if you start improving how you eat, chances are if you eat regularly and healthy, you'll have an impact on your sleep, right? Which will have an impact on your movement and vice versa, which will have probably an impact on your relationships, even though you might not perceive that immediately, right? Then the second thing to say about stress itself, so distress, is that I think science and medicine has done a bad job over the last few hundred years from the 1700s in terms of putting different subject areas and parts of the body into silos, you know. So we have cardiology and we have physiotherapy and we have lots of different silos. The reality is we're all one integrated unit. We're a mind and a body and a brain that lives in a social environment, that lives in a physical environment. So you can't take these things from us. We're all integrated into one system. So when you look at whole health, it is just that, whole health. We have to take all of these things into account. And that's what I think lifestyle medicine does very well. So if you take stress and you think about, let's say, for example, most people, when they think about stress, they think about an external stressor, let's say in the workplace, that has an impact on the thinking process and your emotional regulation, for example, right? So if you zoom into that process, let's say you've got a bullying case in work, your thinking process is going to be impacted, your emotional regulation is going to be impacted. Immediately, that has a direct impact on your nervous system. Your nervous system will introduce neurotransmitters and stress hormones like adrenaline into your system, which will immediately activate your immune response, which has an immediate impact on your gut. Then that has an immediate impact on the probiotics that live in your gut, which have an impact back up onto your nervous system and back up to your mood again. So everything is intertwined. So negative thinking as a result of, let's say, external stress or internal stress. So let's say I'm worrying about an argument I had in the past, or I'm worrying about whether I lose my job in the future. Even that level of thinking will activate the immune response over time. Now you stretch that out over months, now you're going to have a problem. You'll develop a problem in your gut. You'll develop a problem with muscle tension, your nervous system, hormone imbalance, all of those things. So it's so intertwined. So when we talk about stress management, we're talking about, first of all, enhancing awareness of what's happening in here, but also what's happening in the body, right? And mental health is physical health and vice versa. So you can start at any one of the pillars and it will have an impact on stress in terms of improving it, right? It just depends on where your immediate target is in terms of first aid. So the first aid might be the head initially, but you still have to work on the body because stress has an impact on the body and vice versa. And likewise, somebody suffering from a chronic disease, that can have the opposite approach. So for example, you're diagnosed with rheumatoid arthritis, and that's activating your immune response. That is going to have an impact on your emotional regulation and your thinking process. So now we have a different direction. It's coming from the bottom up instead of from the top down. Equally, that has an impact on stress. So it all depends on where it's coming from, but the solution is still all of the pillars of lifestyle medicine, not just one, not just stress management by itself, all of them together.
Yes, I think everyone can relate to maybe having a bad night's sleep, then waking up and feeling tired and not wanting to eat a healthy breakfast, and then it all goes down throughout the day and your concentration goes. And yes, I think a lot of people could absolutely agree to that. But I also wanted to ask you, Padraig, is the role of coaching and motivation in lifestyle medicine, what would you say is the role?
So for me, one of the big differences between lifestyle medicine or functional medicine or any of these, what you might call more modern additions to medicine, is that conventional medicine is really a directional approach, right? So it's a healthcare professional providing direction for a patient, right? Or a service user or a client, whatever you want to call that individual. I'm a patient, you're a patient, we're all patients, right? We're all service users, we're all clients at some point or another. So it's a kind of a one direction. It comes from the healthcare practitioner who society deems as very knowledgeable in a certain area. They prescribe something for you, doesn't matter whether that's a physiotherapist, psychotherapist, doctor, whoever it is. And then you toddle off and you do what you're told. And if you do what you're told, you're going to get better. At least that's the idea, right? So what that does, it takes ownership from the control of your health, right? And what that might be very good in terms of acute disease, like maybe you've got an infection, you need a prescription for penicillin, that's great. Doctor gives you that and you take it and you feel better. But health is much more than that. So for me, when we move into the areas of lifestyle medicine, we have a collaboration with the healthcare provider and the service user, the client, the patient, whatever you want to call us. And it's a collaboration, it's co-ownership of health, where as a psychotherapist, I might be able to advise and we can develop a strategy, co-develop a strategy with an individual where we're on the same team. Yeah, I might be more knowledgeable than the individual in terms of psychological theory, but I'm not more knowledgeable on that person. They're the expert of them and their lives. So it has to be co-developed strategy for health. And for me, that's the difference. Secondly, in terms of coaching, I think we've been very unhelpful in terms of the health sector in general, in terms of advising people, go off now and have a healthy diet, do your exercise, engage in physical activity, and get enough sleep. Here's the sleep hygiene directive now. Go and look at those 8 protocols and go off and do it. Stop drinking, stop smoking, do all of this stuff, live the perfect lifestyle, and you'll be fine. And if you fail at any of those things, well, then you're obviously terrible and you'll never succeed in getting good health, right? That's completely unfair. Human beings find it hard to change habits, right? It's inbuilt in it. We've evolved to be very stuck in our ways, right? And it takes support for us to change, right? Look at every January since time began, people saying, well, New Year's resolution, and they all fail by February, right? I've certainly done that. So as human beings, we're not super women or super men, right? We're human beings. We need support. And there's a huge area of science called behavior change science, where scientists all over the world have spent the guts of the last 60 years trying to develop best practice guidelines for supporting somebody give up smoking, supporting somebody make small changes to diet that lead to big impacts eventually. You know, short-term goals, medium goals, long-term goals. It's not fair to ask somebody to go off and do something without providing support and the tricks of the trade in how to make that change, right? And it's also not good enough to say, go off in an 8-week course, because during that 8-week course, you'll be great, right? But how do you make those things sustained? How do I make this habit change so that if I check in on you in 5 years, well, Kate's still eating that great diet and she's doing her bit of exercise, you know? And so that's where coaching comes in for me. And then finally, what I'll say is what's missing as well is compassion, self-compassion, and not making enormous changes. Like, and what we see in our research is that even tiny changes in perspective of any of the pillars of lifestyle medicine can incrementally have a huge impact on a human being. So it doesn't have to be massive change, but when individuals are supported, if they're told, listen, you're a bit hard on yourself with this, pull the throttle back, cultivate self-compassion, be a bit kinder, realize you're a human being, realize you're a mother or a father with, you know, kids, you're trying to manage that, you're trying to manage social expectations, you're probably doom scrolling on your phone until 1 o'clock in the morning, you're not getting enough sleep, you're not eating well. These are all massive pressures. So it's nobody's fault, but we have self-compassion, make incremental changes. And if you can, and you're lucky enough to have access to a coach, well, then do that, because they will help you then make that sustained and long-lasting change.
Yes, that's really good advice, because even I know myself, you know, you might wake up in the morning, set big goals for yourself for that day, and then when you fail, it's all doom and gloom and go into a spiral. So yeah, I think small steps is probably key in for some situations. Yeah. Ola, I might turn to you now if that's okay.
Yes.
So we're here today to raise awareness for Lifestyle Medicine Week. And I would just wanted to ask you, would you be able to explain how lifestyle choices are the root causes of many chronic illnesses?
Yeah, of course. First, I have to say thank you to Idel and Patrick. I was actually enjoying this so much. So refreshing when you listen to like-minded people. And I obviously, as a pharmacist, I am part of this healthcare system that Patrick was explaining. And just for me to kind of start to talk about lifestyle medicine or lifestyle changes and diet to my patient, I had to be very careful, because some people think this is that based on science? What are you talking about? So I had to be very careful, because obviously I come from conventional medicine background, chemistry background. It's all heavily evidence-based area, pharmacy or medicine or even dietitian, nutrition. It's all based on science. So when you start to talk about to people about their diet, and if they eat this, that will be better than this, you have to be careful, and you have to be, neatly telling them the science behind it in a very simple way.
Yeah.
So coaching, I wouldn't agree more. Coaching is so important. I mean, as a pharmacist, I needed to be coaching people to be compliant, taking their medication. That's really obviously a job, part of my job as a pharmacist, obviously. But now I have to coach them to add lifestyle changes and how to do it, and to be with them, as Patrick's saying, because it's a big change, and you cannot tell people after 2 weeks or 4 weeks of any program, so tell me, how did you get on, or whatever. You cannot just do this, because simply, like, even for myself, when I started to change my diet and lifestyle, I needed to ask questions. I needed someone to tell me, is that okay or not? Or, even though I have the knowledge, but you still need that person who coach you, or to be taking your hand in this journey, because after years of doing something, and all of a sudden you're given a program or an advice to change things for 2 weeks or 4 weeks or 8 weeks, it's not easy, and I always put myself in their shoes, always. And I nearly, because I've done so many changes for myself, I know how it feels, and it's not simple. It's because obviously I've been involved with people trying to give up smoking, or so it is a mindset. It is a mindset, and you really need to talk to this mindset before you try to change anything, and not to simplify it, or that's easy, that's lovely program. I love all the recipes. It may not be their taste of food. It may not be something easy to do. They have a family, for example, or they live on their own, or they need encouragement, to obviously aim for a change. So with all the knowledge that any practitioner have, you still need to walk the walk with them, and it's not just the talk, it's the walk as well. So they need to feel like, oh, so did you do that as well? Was it easy, or just be on that level. So this is what I do anyway, and I think it's important that you really on that level. You're not just the practitioner who is talking from this high step. I have the knowledge, I have the science, I know what I'm talking about. You just have to follow this. No, I just go all the way down. I actually sometimes do some of the recipes with them, and we share photos, and or we have a walk together. So I'll go and walk in around the area. I got with encouragement rather than judging. So I don't judge. So if somebody doesn't, they don't want to do the walk with me, that's absolutely fine. Life can get in the way. We all know that. So I think as a coach or a pharmacist or a functional medicine practitioner or anything like this, I don't really like titles. It's just, I like to help people to achieve that goal, that I can see it clearly for them, but maybe in the beginning, they don't really see it with me. So I like to walk the walk with them, and I think this is the part I am enjoying, because as a pharmacist, you're really stuck in the dispensary. You get a prescription, you read it. Oh, I have to make sure there's no interaction here, and that's all good. Obviously, this is very important for patient health and wealth, but wellness. But it's the beyond this. It's not only just the medication, and this is what I felt I need to know a bit more about, and this is why I enjoyed, studying functional medicine. It's just, I felt this is the balance I'm looking for, and it's heavily science-based as well. There is evidence behind everything. If some people likes to know the science behind it, which I have no problem to share with them. Some people just want to know why they are doing this. Why do I have to not eat gluten all the time? Is gluten bad? Oh, this is like a myth. This is not. So, you have to explain to people why you're doing this with them. And I have no problem to share my own experience. I don't have any problem. I just like to involve them, in their health journey. So it's their journey. It's not mine. I might be their, guide light, but I'm not really gonna do that walk for them. But I will walk with them. Do you know what I mean?
Mm.
So for prevention of chronic disease, obviously that needs a webinar on its own, but I mean,
Yes.
simple things like lowering cholesterol, prevention of chronic disease. If we get them really in the right time, we can prevent, diabetes if we can, obesity. It's nearly a pandemic on its own, and diabetes in kids. We see that all the time now. So simple tweaks and changes, and it has to be simple steps in the start. So you cannot just tell people, oh my God, your food or your diet is crap. You cannot just, this is not really going to help anyway. You really have to, you have a long way ahead. You cannot talk to people this way. It's simple steps, and any change will definitely benefit people. So like Idel said, like if they move every hour, if they drink more water, all of that add up, to a better, healthy life, So this is what I do. This is when I see a prescription for somebody who is on PPI or proton pump inhibitor, the reflux medicine, years and years and years, I was like, oh my God, is this actually working for them? And they're still suffering. So I just help them to understand the mechanism, how it works. Maybe we can just alter the diet a little bit. Maybe we can do this. Maybe we can just, and help them to get the benefit of their diet, while taking their medication, or, just try to have this balance. As a pharmacist, I always feel like I have a stick and I'm holding the stick now like this, rather than just before it was conventional medicine only, now with functional medicine, I feel I am giving my patient more broad advice, and I work with them. I work, obviously, if I guide people for a different diet program, or even how to change their lifestyle, I work with them. I see them nearly every couple of weeks. I give them a call. It's a quick chat, it's nothing intense. So they don't feel like, oh my God, here she is again. No, it's just very simple, just checking in and see if this is, if anything I can do. It could be simple question they don't want to ask. And I never use big words, never. It's very simple words. So we're all on the same level.
Wow.
So I see the benefit when people come back to thank me, which is refreshing, when they say, oh, do you know what? I went to the doctor and my cholesterol is down now, thanks to you. And I've done this and I've done that. It's just simple. I'm sharing my knowledge. That's all I'm doing.
I can imagine how rewarding that would be.
So rewarding. You have no idea. Because as a pharmacist, I felt that there is something is missing. And I like people, I like the social contact. I like to go out and talk to my patient. So it's not only like take this 1-3 times a day and you'll be fine, good luck. No, it will be more. So I always now maybe give a little tip when I dispense and I give the prescription. And I like to go outside myself to hand the prescription. So some pharmacists don't really like to do it, or they're busy. We're busy. It's not like we don't like to do it because but we're busy. So if I am busy, I try to kind of maybe ask them to wait for a few minutes. If I feel I'm going to say something, they will benefit, So this is how I practice lifestyle medicine in my practice. I just, as I said, my advice is now broad. It includes lifestyle changes, and it includes diet changes. And it could be simple as sleep, stress, very simple tips. Unless they want really to sit down and discuss it, that's different. Yeah, but just if I'm giving away lots of good tips, if hopefully, this this is what I am doing, and which is, as you said, very rewarding if you feel people are doing well.
Yeah, wow, that's amazing. Thank you so much, Ola. That was so insightful.
No problem.
I actually just have one more question, but for the whole group, if that's okay, because this week we put out a survey, and a majority of the respondents didn't know how to access a lifestyle medicine practitioner. And I'd just like to would you be able to enlighten our viewers, like maybe just discuss the situation in Ireland about it now, because I think only majority had no idea how to access one of those practitioners. Would you have anything to say on that?
I think Idel can you guide us, because we were discussing this the other day.
Yeah. I mean, I suppose what's so important for people to understand is the huge influence that their nutrition choices and their lifestyle has over their health. Because I think a lot of the time people feel quite powerless. I mean, even if they are prescribed medication and they're on a pathway with orthodox medicine, they feel quite powerless to do anything. And that really is where lifestyle medicine comes in. It was like you were saying, Porrick, empowering the individual to have more influence over their own health. And when you take ownership of that yourself, that's when the change happens. And the word my lecturers used in college was ally. So I'm your ally on the journey. And yes, sometimes I wear my scientific hat, because understanding the mechanisms of what's going on within your body are really important for you to action change, to understand what's happening. And sometimes, yes, we are educating, but most of the time we're just the ally on the journey. And we try to have and provide as many answers as we can. So from the point of view of finding lifestyle medicine support, it can be difficult for people to source it sometimes, because it's not what we would call mainstream medical support now. And it's a real shame. It's a real shame, because I see so many people, and I'm sure Ola sees it even more than I do, with people coming in with prescriptions under their arms that could be helped so easily if they could get access to a nutritional therapist or a lifestyle medicine practitioner to guide them through, lifestyle change. I'm just going to give you one tiny example. I was talking to a weight loss client of mine, and I said to her, let's just talk about your phone for a moment. I said, because if you keep your phone beside your bed and you wake up and the first thing you do in the morning is look at your phone, you've already switched on your stress response. And Porrick, you were talking about this, the stress response, and how stress affects your mind, and then your mind affects your body. If you turn on your stress response first thing in the morning before you've even got out of bed, you've triggered cortisol, which has triggered the release of sugar into your bloodstream, which triggers insulin release, which means you're in fat storage mode before you've even gotten out of bed in the morning. And your goal is to lose, 5 pounds, 6 pounds, 8 pounds, whatever your goal is that we've agreed. You're already in fat storage mode before you get out of bed in the morning, just because you looked at your phone and you've seen the 5 emails that have come in. And that's this really, really simple lifestyle change. So it doesn't have to be massive, like Porrick was saying, global. I'm giving up gluten, I'm giving up wheat, I'm giving up dairy, I'm going on keto, whatever. It doesn't have to be global like that. Tiny, tiny changes. To find somebody to guide you through that, there's 1,000,001 health coaches out there. Really, really well-trained, well-educated, well-resourced coaches. I'm a nutritional therapist. I trained as a nutritional therapist. My background is in chemistry. I did a degree in chemistry before that, and now I'm training in functional medicine. So I would direct people to the Nutritional Therapists of Ireland, to the British Society of Lifestyle Medicine. So there's a number of Irish medics and dietitians and nutritionists who are now training in lifestyle medicine with the British Society of Lifestyle Medicine. So they will be on their books. They can contact them, or you could also contact the Institute for Functional Medicine. So there's a number of us with scientific backgrounds, pharmacy backgrounds, nutrition backgrounds who are training with the Institute for Functional Medicine as well. And our goal is to be the ally on the journey for people to try and find their way back to health.
Thank you, Adele. Thank you so much for that. I just want to say, that was my final question, and I just want to say thank you so much for coming on today and being so insightful and helping our viewers so much. It was really great to meet you again and to talk to you. So thank you so much.
Thank you, Kate. Thanks, Porrick and Ola.
Thanks a lot.
Thank you. Thank you, everyone.
Good to meet you, everyone.